Welcome to Seniority Authority, the podcast where I track down experts to answer your questions on aging. I'm your host, Kathleen Toomey. Let's get smarter about growing older. Let's talk about sex. Contrary to popular movies and assumptions, older people are having a lot of sex. So much so, the STDs like chlamydia, gonorrhea, and syphilis have doubled in the past 10 years for people over 65. Do you want to have more sex? Better, healthier sex? Do you feel like the challenges of aging somehow disqualify you from enjoying sex? Well, think again. Our next guest will help bust some myths about older adults and sex and give you helpful suggestions on how to rethink one of life's greatest pleasures. Dr. Regina Koepp is a board-certified clinical psychologist and founder of the Center for Mental Health and Aging, the go-to online for mental health and aging. With more than a decade of experience working with older adults and psychiatry, she's developed a subspecialty of sexual health and aging. Dr. Koepp is a lead medical psychologist at the University of Vermont Medical Center and creator of the Psychology of Aging podcast, which is terrific, by the way. She writes on aging, sexual health, and mental health for Psychology Today, Psychotherapy Networker, and has been featured in the New York Times, Chicago Tribune, Baltimore Sun, Insider, and dozens of other media outlets. Thanks to our show sponsor, the Riverwoods Group, Northern New England's largest family of not-for-profit continuing care retirement communities, where independent, active adults find purpose, community, and peace of mind. Visit us at riverwoodsgroup.org. Now, let's hear from today's guest. Welcome to Seniority Authority, Dr. Koepp. I'm thrilled to have you here.
Thanks so much for having me and for featuring this really important topic.
It is an important topic, and it's something that we need to know more about because what's happening in reality in terms of older adults having sex is not our current assumptions. We have poor assumptions and poor information about sex and aging. So before we dive into our topic, I just want to talk about why sex is good for everyone, including older adults. Let's just start right there. Why is it good to have sex?
Let's talk about all the benefits.
Well, absolutely.
Some of the greatest things about having sex as an older person is you don't have to worry about pregnancy, right? So there's that.
That's true.
And you probably have a little bit more familiarity with yourself as a sexual person. And so you know what gets you going and how to make your machine work, right? And what drives your engine and what you're interested in and what inspires you. And also you've kind of worked through some of those initial, like when you're younger having sex, you're getting to know yourself. And you have to really work through some of those initial bumps and bruises that come with learning about sexuality and your body and your partner. And so older adults tend to be very good communicators when it comes to sex.
That's good to know.
Yeah. Well, and older adults and people with disabilities. So there's a saying that people with disabilities make really creative, good lovers because you have to communicate often about what your body's able to do and not do and really listen to your partner. If you want to have sex with somebody else, you could also just have sex with yourself, which is also enjoyable. But beyond that, like beyond the sort of what I'm scratching the surface with, there are physiological and physical and psychological, spiritual, relational benefits that having sex as we age, so 60 and older, research has been done to identify that there are actually physical and physiological benefits and cognitive benefits to having sex. And I'm talking like intercourse, oral sex, masturbation, and so on. And so I'll just also say, since we're talking about sex, just a little trigger warning. And because consent is really important when we're talking about sex, that we are going to be talking about sex and we're going to be using sexual terms. And so if this isn't the right day for you, or if you might get triggered by this, then maybe take a break and take care of yourself. That's the priority here.
Very, very important, because we are going to be delving into this topic. So if it's not good for you today, you can stop right here.
Prioritize your health.
And so you're saying that there are mental, physical, and cognitive benefits to having sex as you age.
Yes. Yeah. So let me back up. There's also physical benefits. And they all work together. The healthier the heart, the healthier the brain, the healthier the heart, right? Like the healthier your body tends to be. So they all work in synergy. And so research informs us, this might not be news, that when we have experience sexual intimacy, we have higher rates of dopamine and oxytocin, which is the cuddle hormone. Like people experience oxytocin or have higher rates of oxytocin. Like mothers with babies have higher. It's the attachment, it's the bonding chemical that our brain naturally releases. It also is released during intercourse and like right after intercourse and affection too. It doesn't even have to be intercourse. It can increase levels of oxytocin and bonding and the bonding hormone. And also dopamine, which is a feel-good hormone as well.
We love dopamine.
Yeah.
We love dopamine.
Right. Yes, we do. And that's people can have too much. Like if you have a porn addiction or you have a social media addiction, right? Like that's also dopamine hits and it can get to be too much. But if you're having intercourse or intimacy in healthy doses, then this is good for your brain. It's protective. And also sexual activity increases testosterone for both men and women, and that can be protective of our bodies as well as we age, in that it can protect us from some illnesses and other conditions. And so it actually has some physiological benefits that we want to maintain and preserve. And then we were talking about emotional and psychological benefits. So sex is associated with positive feelings. We know that when people are engaging in intimacy and sexuality, they have lower rates of depression and anxiety. And also, it's kind of correlated. There's a bidirectionality happening, meaning like one informs the other. So if you're experiencing depression or anxiety, you're not going to have as much sex, right? And then if you're having sex, it's going to stimulate all of these chemicals and hormones. Like dopamine is a neurotransmitter in our brain that's like our brain needs to stay psychologically healthy. That when dopamine is dysregulated, then we can have mental health symptoms. And so that's an example of psychological benefit. It's also associated, sex and intimacy are also associated with greater life satisfaction. And so when people are in sexual and intimate relationships, they report greater life satisfaction. And so another reason why it's great to have intimacy as we age. It also enhances self-esteem and self-worth. And I think that's really important when we talk later about certain things that happen as we age that can maybe impact self-esteem and self-worth.
Oh, yes. Yes, that's really important. And we're going to do a little myth busting here today, which I love. Why does our culture assume that older adults don't have sex? And if they do, it's kind of cringy. Well, we have so many bad myths about that.
Yeah, we do. So the first is ageism. So ageism is bias and discrimination based on age. It impacts older adults the most and the worst. And so these are ageist ideas that impact an older person's sexuality are ideas like at a certain time in life, it's no longer important that sex is no longer important. Or at a certain stage of life, it actually doesn't even work anymore. Like you can't get an erection or you experience too much vaginal dryness and then it's over for you. Or this idea that older adults are non-sexual, like actually they just lose interest. Or that if they are sexual, that somehow it's perverse or something to be laughed at, right?
Yeah. And that's very damaging because if someone who is older is interested in having sex, and as we're going to get into, there are more challenges as you get older, and the cultural norm is this is something to laugh at, that doesn't encourage anyone. So I think the goal of what we're talking about today is it is good for you to have sex at an older age. There's all these benefits. So don't let the myths and the negative stereotypes hold you back.
Yeah. And another one that I hear a lot is this infantilization of older people. I think this idea of meaning like that older there's this idea that as we age, we become more childlike, which is a very ageist idea. It's incredibly infantilizing. But if we become more childlike, then that also means we don't have sex, right? Like children don't have sex, or that we can't consent to sex, or whatever that comes with that. But then back to your point about laughing at older people who are having sex, that somehow it's comical. Sometimes I'll do sexual health education programming or courses. And when I tell people like, oh, I'm teaching a class on sex education for people over 65, and then I'll say, STDs are on the rise, like syphilis, gonorrhea, and chlamydia have doubled, like you said in your introduction, in the past 10 years. And when I say that, people will laugh and snicker. And then I'll think, like, what other age group would you be laughing at the rise of STDs at?
Right.
No other age group.
None.
Be a public health concern and a public health crisis. And it needs to be a public health educational point that we need to be talking about sex so that people can have sex in a healthy way and preserve their quality of life. If you have an STD, that's going to impede your quality of life and your health, right? But that leads to stigma. So this idea that people are laughing about sexual health and sexual functioning, sexual interest among older people is one of the greatest impediments is stigma. That if you say that you're in a healthy, loving, intimate relationship with a partner and other people are laughing at you and questioning, like, really? And how do you do that? And why it still works, right? Like there are all of these judgments and that stigma, and the stigma is causing a lot of harm.
How do you think we can, as just normal people in the world, how do we fight back against that stigma? Because we said at the top of the show that the increase of certain STDs is on the rise of older adults. So older adults are having sex, but they're not necessarily talking about it. They're not getting educated about it because there's a stigma. So they're not having safe sex because they're not comfortable having that conversation. Is there a recommendation that you have for us and the people who are listening to destigmatize having sex as an older adult?
Yes. Well, one is having this as a topic on your podcast is one way to destigmatize, to talk about the stigma and talk about the importance of education, talk about how healthy it is at every stage of life, we need love and intimacy and companionship. It doesn't go away when people are 65 and older, right? Yeah. Like this needs to be normalized. It needs to be honored. It needs to be discussed. We need to have, I think, medical providers need better education on sexual health, but also the community, just the average person listening to the podcast needs better education on sexual health.
One of the things that you and I talked about when we were preparing for this podcast is, in fact, that at your typical doctor's appointment, if you are 70 plus, doctors don't typically ask you about your sexual activity, your sexual life. And that's something that we need to change. And you, if you're listening, need to tell your doctor, I'd like to have a conversation about sex. Yeah. Without turning red or being embarrassed, or just let's talk about it. That is important. So if your provider doesn't ask you, you need to say, this is something I'm curious about, or I want to tell you what my activity is. And is there anything that I need to be concerned about?
Yeah, absolutely. I'll say there was a study done with 1,000 older adults. So 1,000 people between 65 and 80. And the study looked at like how often are people having sex and so on. But it also asked, how often are you having these conversations with your doctor? And the conversations are happening only 17% of the times, 17. And
wow.
And when they are happening, the older person is the one most likely to bring it up. And so here's the point. You were saying you don't try not to be red-faced about it. I think be red-faced, be embarrassed, do it anyway. Like really get in there and ask if sexual functioning is important to you. There are all sorts of ways of being intimate. Sexual intercourse and sexual functioning is one way, but it's not the only way. But if that's important to you, then I would say, then talk to your doctor about how can I optimize my sexual functioning if that's important. If you have certain medical conditions, ask, how does this medical condition impact my sexual functioning? How do the medications for this medical condition impact my sexual functioning? How do I dose my heart medication with Cialis or Viagra if that's important to you? Are there other strategies that I can use that aren't Cialis or Viagra that could enhance my performance without taking a medication? And these are really important conversations to have with your medical provider because they'll understand interactions between medications they're prescribing you and other, if you wanted to take Viagra or Cialis, and how to use that safely. They can guide you and advise you in that. But there are other things like creams and pumps that can also help, especially people with penises, enhance their sexual performance. And it's not a systemic thing, like you don't have to take it as a medication.
And I think that's my next question, because we know that aging is not for sissies. It gets harder. There are accommodations and changes that you have to make at every age, but doesn't mean you can't enjoy sex. So can you just go through with our audience what some of the common challenges are when it gets harder to enjoy sex physically and what we can do to improve that just from a very practical standpoint without involving medication, et cetera?
Sure. Yeah. So, I'm 47, so you all know better than me, if you're an older adult, that aging impacts your body, right? So, but as we age, our bodies are more vulnerable to certain illnesses. And so things like heart disease or diabetes or Parkinson's or dementia disorders or arthritis can have a tremendous impact on how comfortable it is for us to have sex, especially with arthritis, and what positions we can get into comfortably or safely. Also, if you're having surgeries like a knee replacement surgery or hysterectomy or like all sorts of surgeries, all sorts of conditions can impact how we see ourselves and our body and our own sensuality, especially when it comes to sort of like a mastectomy or other sorts of treatments for cancer, especially like prostate cancer for men also. And then, or breast cancer for women or other gynecological cancers for women, right? It can impact how we see ourselves as sensual beings. And so can heart disease and diabetes, like I was mentioning. And so can the medications that we take for those conditions can impact our sexual activity, how much energy we have. Chronic pain can impact sexuality and sexual functioning and energy. And the medications for pain can also impact. And so as we're more vulnerable to these conditions as we age, we also can be doing some things to optimize performance if that's important to you. And so I will say that depending on the condition, there may be a grieving process, right? That we need to grieve the loss of an aspect of our life that was really central to our sensuality and our functioning. And that can't be glossed over or done quickly. That each person has their own time frame for that. And it's important to respect your time frame for that and to do the work to really understanding what you've lost and also coming to terms with your body as it is. Older adults are very good at that because as we age, we also, as our bodies might be more vulnerable, our psyche gets stronger. So we actually have more resilience, psychological resilience as we age. And that's not just this group of older adults right now at this moment in time. That's a phenomenon that happens in aging.
Well, I love that. That's great news that we are more resilient as we age, because we should be.
Yeah, you earn it.
Exactly. We've been through some things as older adults, and the fact that we're resilient is terrific.
Yes. And so rely on that. Like rely on, I have been through a hard time and I know that I will get through this too. And so when adjusting to your body and the changes in your body, there is a grieving process. I can't do the thing that I used to love doing. So I worked with a man who had prostate cancer and he had surgery and used the radiation beads. And this left him with erectile dysfunction and with incontinence, urine incontinence, bladder incontinence. And so it was very frustrating for him because he loved intercourse with his partner. And that was the thing that he and his partner did. It was always about intercourse. There was less affection and more just like intercourse. That was how they related to each other. But at this stage in his life, and he, for years, tried to regain ability to generate an erection after the types of treatments he had for his prostate cancer. Some men with prostate cancer can indeed regain functioning, and that's fabulous. For him, that was not an option. And so we began talking with a urologist about, well, is there a penis pump? And are there creams that you can use to help blood flow into the penis to generate an erection without the mind doing it? Right. Because it was not working with the traditional means. And then it was also talking to his partner. Like, so how do the partners have conversations about the changes in the body?
That's really important. If you're getting smarter, let us know. Leave us a review, a rating, wherever you listen to podcasts. Tell your friends and follow us on social. We're at Seniority Authority on Facebook, Twitter, Instagram, TikTok, and YouTube. And don't forget, if you're listening to YouTube, hit the notification bell so you can subscribe. Or subscribe to our newsletter at seniorityauthority.org so you don't miss a thing. For our listeners, we've talked about maybe you ran marathons as you were younger, and maybe you're still running them, or maybe you're saying, I can only run a half marathon, or I can only run 10K, or I'm playing pickleball instead. It's a matter of adapting to where you are so that you can get those benefits, those physical benefits, those mental benefits from activity, but just realizing that, you're going to do it a little differently than you did when you were 20. Same thing with sex. It's going to require different adjustments. And there are creams for vaginal dryness, and there are certainly Viagra and Cialis. And it's important to not give up and to say, I can't do this the way I did when I was 20 in the backseat of a Lincoln or whatever car you had.
Thank God you're not doing it that way anymore. Nobody
Exactly. But there are other things I can do. There are other options. And so if our listeners are interested in exploring that, where would you suggest they go to get this information?
Yeah. So that's a great question. One of the things I would say is you could go to an older adult supply store. I would love to start an older adult shop for
that would be good.
Yeah, but you could go to an adult supply store. You could even order these things on Amazon, like toys and lubrication and so on. I worked with an older couple. They were in their 80s. They're a heterosexual couple. It was a husband and wife, and he was more interested in BDSM, like bondage and masochism in the bedroom, and she was not. And so they'd been married for 50 something years and had a lot of ups and downs in their marriage. And a lot of our work together and therapy was helping them see each other's points of view and respect each other's differences and cultivate more intimacy in their marriage. And it started with emotional intimacy, and then it progressed to physical intimacy. They were on a cruise, and he was hard of hearing. And so he goes up, using his walker, and he was proud, as he should be. And he asked on the cruise, in the pharmacy on the cruise ship, like, where is the lubrication? And I need my jelly, and was just shouting it out that they needed resources for their lovemaking. And they had the best time. They came back to therapy, and they were like lovebirds. They were just two peas in a pod. They had a fabulous time. But at any stage of life, it's an option. So I would say you can explore on Amazon. They have great toys on Amazon that you could order. You'd be surprised if you start talking with your friends, what gets revealed. You can look for lubrication at any drugstore like CVS, et cetera. There's KY jelly. There are flavored lubrications. For things like a penis pump or creams to help with erection for people with penises, I would say if you're talking with your physician, ask for a consultation to a urologist. Okay. And a urologist can help The thing is that it's important to talk with your doctor about any changes like that you're going to be making, just in case there are any contraindications for you. And so that's one reason to have the conversation with your doctor. And you might have to start the conversation. And remember, do it red-faced anyway.
Red-faced. Okay.
Yeah.
Do it no matter what. You just brought up an interesting thing. I'd like to explore that, the difference between intimacy and intercourse. And it's something that is, I think, often confusing when people are in their 20s or just entering the world of intercourse. But how does that change typically as we get older? And what do we need more of? So let's talk about that.
Yeah, well, I would say every relationship is unique in terms of what it needs more of. Some people have physical intimacy and physical intercourse and need more emotional intimacy or more commitment or more mutuality, like reciprocity. So some relationship and intimacy researchers years ago came up with this idea that there are 5 different types of intimacy. There's commitment, which is like a sense of closeness, cohesion, and connection. There's affective intimacy, affect meaning like emotion, which is a sense of caring and compassion and positive regard for your partner. There's cognitive intimacy, which is this idea of thinking about the other person, even in awareness of the other person, even when they're not there. Like, oh, I'm at the store and I know my partner likes flowers. I'm going to bring flowers home. And then there's mutuality, which is a process of exchange. So, there's this idea of climaxing together, or I'm going to help you climax and then you help me climax. That's this sort of act of reciprocity and mutuality. But it doesn't only have to be around physical. And then there's physical intimacy, which we're talking a lot about, which includes sexual intercourse, but also can include cuddling, fondling, oral sex, holding hands, kissing, just sitting close to one another. And so all of these types of intimacy are intimacy.
How often do people come to you because they are needing a recharge of intimacy or intercourse as they get older? Sometimes it can be harder to do that, or sometimes if you're with a longstanding partner, it can be harder to look at that partner with new eyes. Or do you have a lot of your clients or patients come to you with that question? And what do you advise?
It's interesting. So I'm a couples therapist, of course. And when I work with older couples, often the sexual intimacy is not the presenting problem, though it can be. But other sorts of impairments in the relationship are the problem. So sometimes it's around caregiving. So what can happen is that as people begin to be more vulnerable to illness, and as we acquire illness, sometimes, depending on the illness, we require care. And oftentimes it's our partner who's providing that care. And that role shift can impact sexual intimacy between partners because it's moving from a partner dynamic to patient and nurse dynamic, to a person needing care and a person providing the care, where it's out of a partnership role dynamic and it's become shifted and the power dynamics get shifted. And so there's a different type of connection that's happening between the couple or between the partners. And that can interfere with intimacy as well. So often it's like, we're struggling in this new dynamic related to caregiving. Often for older folks who are coming into my office, it's related to illness. There's a new illness in the family. There's a new illness in our relationship, and it's impacting both of us, help us. And one of the ways it's impacting us is around intimacy.
Sure, because one partner is dependent on the other partner. So it's a less equality and more dependence, and that I can see where that would make a change.
But then to answer your question more specifically, I would say that in that same survey that I mentioned about how often older people are having conversations with their doctors about sex, this survey, remember, it's 1,000 people between 65 and 80, looked at how interested are older people in sex and so on. And that survey found that 67% of that age group, 65 to 80, are interested in sex. 67% interested in sex. 72% had a partner. And the majority, 54%, were sexually active with their partner. And here's the thing that I think why I might not see people coming into my office with a sex problem, because 73% reported being satisfied with their current sex life.
That's
So,
good.
Yeah.
So a lot of high satisfaction.
High satisfaction. So, and then it looked at, okay, men and women, 51% of men, or close to 51% of men, and close to 31% of women are sexually active.
That's great. That's great news.
Yeah. But so that's also like why if there are other therapists out there, you might not see an older couple coming in with a sex problem or a sex deficit, but you might see the couple coming in with other deficits, and also underneath is a sex or intimacy deficit.
What do you think holds older adults back from talking about sex or seeking out sex? What myths do older adults still believe about having sex that kind of hold people back that you'd like to share?
Well, I think some of the biggest ones we've talked about, but I will say there's an idea that it just won't work anymore. That just might not be true for you. Even Robert De Niro just had a baby. He's 79, right?
Yeah, yeah.
And then there's another myth that I think is really important to dispel, that older adults are straight. There was a Boston Pride Parade several years ago, and older women were carrying a banner that said 2468, don't assume your grandma's straight.
That's awesome.
Yes. Yeah. But so there's this idea that older people are all alike, that older people are all heterosexual, or right. But that's not true. I mean, I will say 3% right now, 3% about people 65 and older self-identify as lesbian, gay, bisexual. However, every cohort of younger folks more and more identify as lesbian, gay, bisexual, transgender, etc., LGBTQIA+. And so those people are getting older too.
Absolutely.
But it's not that there are more gay people who are younger. It's that it's safer to be out. And for many older people, it was not safe to be out. And so often in my therapy room, what I hear is, I'm in a heterosexual relationship, but I had same-sex relationships earlier in my life where I knew true love. And I love my spouse, but I also don't want to go the rest of my life, these last chapters of my life, never knowing that deeper love again. And so there is a common misconception that older people are straight, and that's also not true. And so just to broaden our hearts and minds, and also sexuality is fluid and can change throughout our lives. And with more permission in society and more safety in society in certain states to be out, you might be seeing or hearing more friends in same-sex relationships or questioning.
Yes, I can totally understand that, because if you have not been allowed your entire childhood and young adulthood to be safe, saying what your preferences are, now you can, that presents an opportunity for you to explore. And I do think there's these myths that older adults are straight and asexual. And that's the whole purpose of having this podcast, that guess what? People are having sex, and think about it, talk to your doctor about it, be safe, because you may not get pregnant, but you can have an STD. So just
use protection, use a condom.
Yeah, exactly. So last question on this topic. If you could change one assumption or practice or thought of older adults around the topic of sex, what would that be?
I would say sexuality is normal. I would say that. It's healthy. It's expected. It's unusual if people aren't curious about their bodies in a sexual way, right? There is an identity called asexual. So I'm trying to use more the term non-sexual for people, the stereotype that people are non-sexual, just to be inclusive of people who are asexual. And I don't know all of the features of asexuality, so I'm not an expert on that. But I will say that sexuality is healthy and normal. It exists on Maslow's hierarchy of needs. Like if we think of Maslow's hierarchy as a triangle, at the base is eating and excreting and sex. And in the middle, sex shows up again in relationships. It's human. It's part of our foundation and it's part of what connects us to people. And so that I would say is like, let's stop stigmatizing and tabooifying sexuality as we age and start normalizing it, start helping older adults to have conversations about intimacy and sexuality, start using protection. Also, older adults didn't get sexual education in their schools. It started in the 80s when I was coming up, and we didn't even get that much. It was abstinence only education then. And so that's what I would say is that sexuality is normal, it's fluid, it's healthy, and it's to be respected and honored.
Well, I am so excited we had this conversation. I can't wait for the comments to come in on this, comments and questions, and start a conversation about it. And if we get enough comments and questions, maybe we can have Dr. Koepp back. But let's start talking and doing and having more enjoyable sex. So before I let you go, we have this Fast 5 lightning round. We already know you have great knowledge about sex and aging, but now we want to get to know you a little bit better. So share with our audience, what's your favorite guilty pleasure?
So I just moved to Vermont last summer.
Which is beautiful.
I love vanilla creamies.
Okay, vanilla creamies.
Not from the Northeast. I guess creamy is a soft serve ice cream.
Okay, well, you're in the land of Ben and Jerry's, and we eat more ice cream here in New England than any other part of the country, even in the winter. So that's good. What's your favorite healthy practice?
So I'm doing more weightlifting and walking with my students. So I train residents and psychology grad students. And so taking walks with them, talking about their cases.
That's great. Great. I love that. Walking work. What's guaranteed to make you laugh?
The Marvelous Mrs. Maisel.
Oh, I love her.
Marvelous Mrs. Maisel. I'm obsessed.
I love her. I love her, her dad, her manager, her mom.
The writing is brilliant.
Yeah. Yeah. I'm with you on that. Tell us about the last book you loved.
The one I really loved, the last one is Vanishing Half. Have you read it or heard of it?
That I have. I've read that. That is a fabulous book. Ellison, I think, is the author's name.
Oh, gosh. Now, I don't know.
I'm not sure, but Vanishing Half is fantastic. Came out last year, I think.
I think a couple of years ago.
Okay.
Yeah. And it's set in the South and between the South and California. It looks at a family through a multi-generational lens. It explores identity, like race identity, gender identity. It's brilliant. It's great.
Yeah, I love that. And favorite escape, if you could go anywhere, where would it be?
So I had kids in my 40s, so I have little kids. Anywhere without my kids. Sometimes it's just bed, just going to bed at 8 o'clock. That's my favorite escape.
I just read something about Mother's Day and a column about Mother's Day, and the writer was saying, I just want to be without children on Mother's Day.
Yeah. This Mother's Day, my daughter has a double header soccer.
Okay. So maybe you'll get breakfast in bed.
Maybe coffee. I'll just aim for coffee.
Keep it simple.
Low bar.
Well, thank you so much. This has been delightful. I think this is really opening up some minds and some hearts, and welcome everyone's questions. And just thank you for doing this really important work, and thank you for sharing it with us.
Yeah, thanks so much for having this topic on your show. It means a lot to me and to thousands of older people, I'm sure.
Awesome. Thank you very much. That's our show for today. If you liked it, please tell your friends so we can reach more minds and keep the conversation going. Or follow us on social at Seniority Authority. I'm Kathleen Toomey. Until next time, enjoy your chance to get smarter about growing older.